Hi there, I'm Renos Vakis, lead economist at the World Bank, and your host for Accelerating Development Ideas for Impact. This is not your typical podcast. It's an AI powered conversation brought to you by the World Bank Institute for Economic Development, where we unpack the latest research with one goal in mind turning big ideas into real world impact. Let's get started.
Thank you for the introduction, Renos. Think about a time your phone buzzed with a forwarded message from a relative warning you about some new health risk. It looks official, it sounds scary, and before you know it, you're questioning what to believe.
The anxiety of trying to figure out if a post online is real or fake is now a very familiar part of modern digital life.
Today on our show, we're looking at a fascinating paper titled Find the Fake, Boosting Resistance to Health Misinformation in Jordan with a WhatsApp chatbot game. And it really gets into how these everyday digital moments escalate into massive policy challenges.
Absolutely, because misinformation and disinformation are now classified among the 32 most severe global risks. It's not just about confusion. The direct costs across different countries and sectors was estimated at roughly 78 billion US dollars in 2019.
That's a staggering price tag for bad information.
It is. And the problem is just as visible at the local level. Take Jordan, for example, where a survey found that many people believed widely circulated false claims about vaccines, including the idea that vaccines contained microchips. When large numbers of people question basic health information, it becomes much harder for governments and health systems to respond effectively during a crisis. It's not surprise then that COVID-19 vaccination coverage in Jordan was still under 50% of the population as of March 2023 when the pandemic was winding down.
Picture a parent scrolling their phone in a clinic waiting room, trying to make the right choice while invisible rumors actively work against effective treatments.
Exactly. And that skepticism doesn't just stop at one disease. It can spill over to confidence in other vaccines like measles vaccines, where we've seen outbreaks re-emerge in places where trust has weakened.
So, how do we actually fight something that spreads that easily?
Well, a recent randomized experiment tested a really innovative solution in Jordan with more than 2,800 participants. Rather than correcting false claims after people encountered them, the researchers tried to prepare people beforehand. Through a WhatsApp chatbot game called Find the Fake, users practiced spotting tactics like emotional manipulation, fake experts, and altered images while receiving instant gamified feedback through scores and badges. The goal was to build a mental toolkit people could use whenever they encountered suspicious content online.
I love that concept. It's literally like giving the mind a vaccine against fake news before it gets infected.
That's exactly the idea. And it brings us to the first major policy takeaway: gamified, comprehensive digital inoculation tools that teach people how to distinguish between misleading and credible information can improve the public's ability to detect misinformation. But there's a crucial catch.
Here's where it gets interesting, because they tested 5 different approaches to see what works, right?
Yes, 5 study arms. They had a comprehensive chatbot game inoculation, which was a game showing both true and fake examples, and a brief chatbot game inoculation showing only fake examples.
And they also tested infographics, teaching about the same misleading techniques, which are more passive for viewers than a game. A placebo infographic about road safety, and a standard control group that only completed the assessment quiz.
Precisely. And what stood out was that the comprehensive game helped people become better judges of information overall. Participants were more likely to identify misleading content correctly while also recognizing when information was credible.
So it wasn't just helping people spot fake headlines, it was also helping them recognize trustworthy ones.
Exactly. It improved discernment rather than simply making people more skeptical. Participants learned to separate reliable information from misleading information, which is exactly what policymakers want.
But what happened with the brief game that only showed fake examples?
That's one of those classic moments where the policy design seems logical, but human psychology throws a wrench in the gears. The shorter game did help people spot misleading content, but it didn't improve their ability to recognize trustworthy information.
So it didn't really teach people the difference. It mostly taught them to be more suspicious?
Exactly. And the infographics didn't significantly improve people's ability to distinguish between misleading and credible information either. Simply reading tips about misinformation wasn't enough.
Almost like reading about how to drive versus actually getting behind the wheel.
That's a great way to think about it. The interactive experience of practicing these skills appears to matter.
Which brings up the real tricky part policymakers face, because it's not just about spotting fake news, it's about what people decide to forward to their friends.
Exactly. And this is where the findings become specially important. The comprehensive game reduced people's willingness to share misleading headlines while leaving their willingness to share credible information largely unchanged.
So it helped slow the spread of misinformation without discouraging useful information from circulating.
It really did. And that's critical because public health systems depend on trusted information moving through communities, especially during crises.
What about the brief game?
The brief game also reduced people's willingness to share misleading headlines, which sounds positive at first, but it also made them less likely to share credible information.
Wow, so just exposing people to fake examples made them skeptical of sharing any information, even the good stuff.
Yes, it made users way more conservative. So the policy implication is clear. It can be beneficial to contrast true and false information to prevent a blanket skepticism of all health information.
That connects the dots for me, like teaching someone to spot counterfeit bills by only showing them fakes. Suddenly, they don't trust real money either.
That's a perfect analogy. And this leads to our second key takeaway, which is about how we deliver these tools using widely used social media platforms like WhatsApp.
Delivering health literacy directly on WhatsApp makes so much sense for reaching people with lower digital literacy, rather than forcing them to navigate a clunky website.
It provides a user-friendly, scalable channel.
And users actually wanted to share the intervention with others, didn't they?
They did. Participants who played the chatbot games were more likely to recommend them to others than people who only viewed the infographics. That's encouraging because interventions that people voluntarily share may be able to spread through communities more naturally.
Some of our audience designing public interventions will immediately recognize the tension here, though, because how do you keep people from just clicking away?
That's the ultimate scale versus impact trade-off. The most effective version of the game took about 10 minutes to complete.
10 minutes is an absolute eternity on a smartphone.
It really is. The brief game took 7 minutes, and the passive infographics took only 4 minutes. So policymakers have an important choice to make. Is it better to reach a very large audience with a quick intervention that has limited impact? Or a smaller audience with something that meaningfully changes how people evaluate information? That's the trade-off highlighted by this study.
It proves that building trust in public health isn't just about broadcasting facts. It's about helping people develop the skills to evaluate information for themselves.
I couldn't agree more. And perhaps the most important lesson is that this isn't really just a COVID story. The same misinformation techniques appear in discussions about climate change, politics, financial scams, disaster response, and many other areas of public life. Rather than constantly chasing the next false claim, governments can help people become more resilient before they encounter misinformation in the first place. That's a very hopeful step forward, not just for public health, but for building trust and resilience in the digital age. Over to you, Renos.
Thank you for joining us. You can find the full report on our website. Just follow the link in the description. Be sure to subscribe to be the first to know about upcoming episodes. And before you go, how do you plan to put what you learn into practice? And what topics you'd like us to explore next? We'd love to know. Until then, goodbye.